Hello, everyone, and welcome to NHIS Campus Connect podcast. Today, we are coming to you from the University of Cape Coast, where NHIS Campus Connect initiative is engaging students and bringing health insurance services directly onto campus. I'm joined by two student voices from UCC to talk about what the initiative means for students and why NHIS matters more than we sometimes realize. My name is Shanice Palm. So I would first talk to the lady on my immediate right. What's your name?
Hello and thanks for having me. My name is Gemina Elomahiavo.
Okay, what program and level are you in?
I'm reading BSc Psychology and level 400 student.
One fun fact about UCC that someone else I don't know doesn't know.
Okay, one interesting thing about UCC is that according to the World University Rankings, we rank the first university in Ghana, first in West Africa, and 11th in the whole of Africa.
That's some serious ragging, right? What about you?
My name is Mameya Nyamiche Esiedu.
Okay, program and level.
I'm reading Biomedical Sciences, a level 300 student.
Fun fact about UCC.
Okay, so one fun fact about UCC is while you are even on campus, especially at the old site, you are able to see the ocean from afar, which is really good.
Therapeutic, eh?
Yes.
Anyway, you're both welcome.
Thank you.
So I want to ask you, what was your first reaction when you heard NHIS Campus Connect was coming to UCC?
Okay, honestly, as the SRC General Secretary, I was really excited because one thing the SRC does as part of our initiatives in every semester is to bring NHIS to campus to help students renew and then register their cards for free. So it was part of our SRC week schedule to actually bring them to campus to help with registration. When we heard you were coming, it was a relief and joy because we didn't have to reach out. We already had you with us.
How about you?
All right. So when I heard NHIS was coming to campus, I was also excited because I believe that it is one paramount thing every individual, especially when it comes to the student's body, must have on themselves. You may not know when you will fall sick, so you need the NHIS to subsidize some costly medicines.
Okay, do you think NHIS bringing the services directly to campus has brought any difference when you compare it to you visiting any of our district offices?
Yes, please.
Okay, what kind of...
This is because when you are on campus, it creates some form of easy accessibility to the students, not to go and probably queue for your card.
That's like giving you some VIP treatment.
Yes.
How about you?
Okay, so it was good. It has been good actually because it actually increased our knowledge about what NHIS is about. Normally we'll just register and renew our cards because we have to. But now our knowledge base has increased. We know what it entails and a lot more information about it than initially.
Okay. So I want to ask this question. Before NHIS Campus Connect came, what was your initial knowledge you had on National Health Insurance Scheme?
Okay, I knew it to be a scheme that helps us access healthcare at a subsidized cost as it takes up the cost of some medication.
Some medication.
Yes, that's what I knew initially.
Like what medication? Because we know we cover like over 500 medicine lists. That's what I'm asking.
Oh.
There's also a misconception saying that we cover just paracetamol, but we do not. What about you?
Okay, so just as she said that NHIS reduced some of our medications, even I think with surgery too, that they are able to pay for some surgeries, especially in children. That is what I also know about NHIS.
Okay, just this past Wednesday, you had the 21st Century Wellbeing Conference where the chief executive of NHIS was the keynote address person. What was your key takeaways from his address?
Okay, so one key thing I took from his address was it is equally good as a student to get your NHIS done, just as you are studying, because you may not know when you fall sick. Your health is as important as your studies.
What about you?
Okay, what I took was that in all our efforts to balance our academics with our emotional challenges, we should make sure we prioritize our health as well, as it is a crucial part of our lives. If we keep learning and then do not take care of our health parts, we might actually be failed by our health at a point.
Great. Yeah. Let's talk about life experiences. Have you used the NHIS card before?
Yes.
Please share your experience with us.
Okay, that's quite an interesting one. Yes.
We are all ears.
So I have parents who are very keen about NHIS card renewal and then all of that. And as kids, we didn't get why we always had to renew our
You didn't
cards. We
understand.
didn't understand. Like they were worrying us. So I came to school once and then I went home and I had to visit the hospital. I was ill. And as usual, I hadn't renewed my card because
Oh.
my dad didn't do it. So I got there and I just submitted my card to be treated and I was told I had to renew before I could access the healthcare as it would help myself. I had to call my mom and then as an African mom I received blasting. But after that I registered and I didn't like the fact that I had to renew before accessing healthcare while others were just going to once they submitted their cards. So since then, I always made it a point to renew my NHIS card at every point, always checking to make sure it is active.
And the unfortunate thing is that if your card is inactive for over 90 days, when you renew, you have to wait for 30 days before you can use it.
Alright.
So that's why we always ask our members to do the auto renewal subscription. What about you?
Yes, please. I've also used the NHIS on several occasions.
Share experience with us.
And one thing is, I remember when I went to the hospital, I was given a whole lot of medications. But looking at the cost that I was given, I realized that it was at very low price. And I asked the nurse, why is it that it seems the medications are too much, but the price is low? And I was told that the National Health Insurance Scheme is taking care of it, which made me very happy.
Do you think NHIS Campus Connect, the initiative, do you think is important and why?
Yes, it is very important. As on campus, yes, it is very important because this is where you get a number of the students. And then I would say that students on campus may take a large percentage of the whole population. So bringing NHIS on campus will help every student or most students to register for it. Thank you.
What about you, Mimi?
Okay, I believe NHIS Campus Connect coming to campus has actually increased our knowledge base. As initially, most students didn't see why we brought NHIS to campus for them to register and renew their cards. But with you on campus now, we receive calls from students where the registration ongoing, they want to come and register. And I believe that's because their knowledge base has increased. They now know why they should actually renew and then register for their NHIS.
Okay, briefly, in one sentence, can you look into your camera and tell your fellow tertiary students, give them an advice on NHIS Campus Connect?
Hello, everyone. I would say something very brief about NHIS Campus Connect. As the SRC General Secretary, as I keep saying, I have experienced them as they came to campus at the forefront, received them, and then worked with them. I must say that we have learned a lot from them. The experience has been great. Our students have really benefited, and I would advise anyone and every campus actually yearn or even invite them to their campus to interact with them.
What about you, Mama? Yeah.
Okay, so what I will say is your studies is equally important as your NHIS card. Thank you.
Thank you so much, Mameya and Mimi, for sharing your experience with us and also sharing your nuggets of wisdom to your fellow tertiary students. Now, to every student listening or watching, your health is one of the most important investments you can make while pursuing your education. The NHIS Campus Connect initiative is here to ensure students are informed, protected, and able to access healthcare when they need it. So if NHIS comes to your campus, register, renew your membership, ask questions, and learn more. Follow us on all social media platforms displayed on your screen and visit our website www.nhis.gov.gh for more information. Thank you so much for spending time with us.
Thank you for having us.
This has been NHIS Campus Connect podcast, coming to you from the University of Cape Coast. Thank you for listening. And remember, stay healthy, stay informed, and stay covered. My name is Shanice Palm.